As the U.S. death toll from coronavirus surpasses 50,000 now, a handful of states are allowing some businesses to slowly reopen. In Georgia, barber shops, hair and nail salons, bowling alleys, gyms, and massage parlors opening today. On Monday, restaurants and movie theaters will join that list. In Florida, discussing when the state will reopen, Governor DeSantis creating a task force which met for the first time this week.
All right, Dr. Christie Alexander with the FSU College of Medicine joining us again today. She's live from the Northwood Testing Center. Dr. Alexander, thanks so much for being here with us.
Thank you again for having me.
Yeah, always our pleasure.
Yes.
So we had you on Wednesday, and we talked a little bit about this, but now that it's actually happening, we want to know, what do states like Georgia need to do to prevent a second wave of the coronavirus from spreading?
Well, yes, it is actually happening, and unfortunately so. It would be better if none of the states opened quite yet. I can give you some statistics that might help you understand why I'm saying that. So far, we still don't have a vaccine. That's several months away. We still don't have treatment. We hope it's only weeks to months away, but we're not sure about that. So the only thing we go off of is testing. And as of right now, 20% of people tested in the United States have been positive for coronavirus. And those are just in the high-risk populations, the people with active symptoms and things like that. What we're looking for is less than 10% positive cases of all of those tested. And in countries like South Korea, their numbers are down to 5%. What that tells us is you're testing more people and you know the rates are going down. So without those kinds of numbers, it would be much better just to stay put and not reopen until we get more information, like more testing, for example. Now, for those that are reopening, I hope they keep all of that in mind, because what that means is we're not out of the woods yet. And if we could, people, the big thing will be social distancing if people choose to go to some of these places that are opening, which will be hard to do in the case of something like a barbershop, for example. So you really have to take into consideration what it is that you need to get out of that experience and make sure that you really actually need that service at that time. If you do have to go to one of these places, everybody needs to be wearing a mask, and then good hand washing consistently throughout, and lots of cleaning of the businesses during the day and after they close.
We're learning about a new potential symptom related to the virus, red swollen toes. Can you tell us more about how the virus would cause that? And is this a symptom that you guys are starting to see a lot of?
We haven't seen it yet, but I've heard a lot about this, and not just red swollen toes, but rashes. Rashes that you can't even tell what they really are. And what we think all of that might be is this is such a new virus for the human race. Our bodies are reacting to it all the way through. It's not just our heart anymore, our lungs, the various symptoms that we've been talking about, fevers and things like that. Now we're seeing manifestations of the skin, because the skin is the largest organ of our body. So with that, we don't know if it's autoimmune. We don't know if it's inflammatory. Some people have even said it's blocked blood vessels that are causing some of the various rashes that we're seeing. But it is something that we're looking out for now, because we're seeing it more frequently in patients that have coronavirus.
I just want to follow up with, so it sounds like, we're learning more. You've been saying that as long as you've been joining us. If somebody is experiencing a condition that maybe, they don't have a reason to point to as to why they might be experiencing it, could they look at it as potentially connected to the virus, and maybe they should go get tested?
Very possibly so, just like anything, right? If coronavirus wasn't here right now and some funky rash happened, wouldn't you want to get it checked out? So that applies to all symptoms anyway. And yeah, absolutely. You could consider it possibly due to coronavirus at this point, because there's a lot we still don't know and we're still learning on a daily basis.
Dr. Alexander, one of our viewers wants to know, how long is it after someone contracts a virus that they would test positive? Is there a time frame that you'd be able to give us?
That's a great question, and we really still aren't completely sure of that. We base it on symptoms at this point, which is tough because, like we've been talking about, lots of times people are asymptomatic. But for those that actually had the fever, the dry cough, the shortness of breath, or the difficulty breathing, what we're saying is, as long as they're symptom-free from the beginning of those symptoms for 7 days, and then completely without a fever, completely afebrile for 72 hours, that is what we're using right now as indication that they might be past it. The other thing that some places are doing, depending on acuity, is 2 negative COVID tests 24 hours apart to confirm that the person is truly negative for the virus. But the problem with that one is we don't have enough tests. So that would be the ideal way of knowing, and in some places we are using that where it's really mandatory, but otherwise we have to base it on symptoms at this point.
A lot of people are talking about this across the country right now, what can and can't kill the virus. A lot of us know ingesting things like disinfectants and chemicals, probably not a good thing to do. But just to clarify, what do we know right now can and can't kill the virus, if anything, as pertains to what we actually put in our bodies?
We actually don't have, like I said earlier, we still don't have any treatment to kill the virus. And so that would be the thing that you're looking for first and foremost. There isn't any magic bullet for this. The heat, the sunlight, UV rays, if that were the case, we'd be rolling people out of the hospitals and putting them out in the sun. That we just don't have that. And I have to say, one of the biggest toxicities that hospitals see is people drinking rubbing alcohol. That could be something that happens in hearing these reports that we can drink something and make it better. And actually what happens with rubbing alcohol is it becomes nail polish remover in your system and will completely destroy your pancreas and can cause hemorrhagic gastritis as well. So all I can say is please, please, please don't ingest anything that's toxic. And every one of those things, the bottles of rubbing alcohol, bottles of bleach, things of that nature, have those warnings on the bottles for a reason. So please take good care and practice good medicine.
All right, we've talked about something that's called Sentinel testing before. Can you explain that for us again, and also why it is important?
Sure, this is actually a really hopeful thing. So when we think about Sentinel testing, it's doing the testing on several people regardless of symptoms, regardless of their exposure to the coronavirus. So it just gets a broader view of how vast the virus is spreading. As a matter of fact, this weekend, FAMU is opening its fields to do coronavirus testing for anybody that wants it. And they're going to be doing up to 200 tests a day for 14 consecutive days. And what that helps us determine is how broad this thing is in our community alone. So that's sort of a rough example of what Sentinel testing kind of looks like. And it might give us a better indication of how far spread it is here, at least in our community.
Tests now show a woman in California died early in February, had coronavirus. She died from it. Are there other signs that the virus may have been here earlier than previously thought? And could some of us have actually had coronavirus? And I think maybe this is the asymptomatic group too. So that might be the answer to this part of the question, but have had the coronavirus and not even realized it.
Absolutely. We didn't even know what we were getting into that early on. I think there were a lot of people complaining of these really strange dry coughs, and everybody was thinking it was just bronchitis. And you look back and say, I wonder if I had coronavirus. I've heard that from several people, and I think there's a lot of truth to it, because at that point we weren't even knowing that we should be testing for something like that here in our country. And there was still travel happening from the holidays and so forth. So it's very likely actually that people could have had it and recovered from it and never have known.
Okay, and obviously there's a lot of changes, a lot to talk about. So before you go, we always like to give you kind of free range to talk about whatever you'd like. Is there anything you want to add today?
Not really, just to make sure that everybody is just, thinking about the science, checking in with CDC if you're questioning whether something might be factual, really listening to physicians and scientists who are working really hard to get ahead of this thing. And I promise all of you, if we could cure it and get rid of it today, we would be. This isn't trying to keep people sick. We just want everybody to get better, but we want to do it the right way. So please stay safe. Continue to social distance, physically distance, as I like to say. Continue to wear your masks if you have to go out, and practice good hand washing, and continue with the stay home orders as directed. Again, like I said last week, you guys can be our healthcare heroes too, just by protecting us in that way.
Okay, Dr. Christie Alexander, you're certainly one of our heroes here.
Yes.
Honestly, coming in and joining us a couple times a week to answer these questions, our viewers, and we are finding this information so valuable. So I know we'll talk with you again next week. Stay safe and try to have a good weekend, okay?
Thank you. You guys too. I appreciate it so much.
And for our viewers, of course, you can always rewatch this interview or see our previous ones online at WCTV.tv.